You live now to the Ontario Legislature, where question period is underway. We'll listen in.
Alternative payment plans so that physicians have the opportunity to practice in those underserviced areas. We have a new program in the province of Ontario, peer-to-peer emergency department physicians being able to phone a friend and talk through issues. That has ensured that people actually have access when they need it. We now have in Northern Ontario physicians who are in our emergency departments having access to other physicians who have practiced for longer and are able to walk through specific issues. That one change alone has ensured that we have had no physician shortages or issues in Northern Ontario. Those are the kinds of policy changes that are actually being suggested by our hospital partners and making an impact in our communities.
The final supplementary.
Phone a friend, Speaker? That's their fix? Are you kidding me? That is cold comfort for all of those people out there, thousands of them, whose emergency rooms and clinics have closed. 2.2 million Ontarians who don't have access to primary care. The newly renovated Mindamoya Hospital had to close because this government didn't fund the staff to keep it open. Hospitals and long-term care homes are being gouged by private staffing agencies taking over our healthcare system. Perth and Smith Falls Hospital was forced to spend a whopping $2.8 million this year on temporary staff through private agencies. I've talked to local hospitals in northern communities who are worried about making payroll. Speaker, we need investment to finally address these staffing shortages. Will the Premier stand up and commit new hospital funding to ensure care is available when the patients of Ontario need it?
Minister of Health.
Where was the party opposite when we actually announced through our last budget an expansion of primary care? They voted against it. Where was the party opposite when we have made investments and made announcements of over 50 new capital expansions, whether those are new builds in Niagara South, whether those are expansions in communities across Ontario? Where was the party opposite, the NDP? They voted against it. We'll continue to make those investments. In last year's budget alone, we had an average increase in our hospital budgets of 4%. Those are the changes that we make as a government to make sure that our hospitals and our community system is robust and there for us when we need it. Thank you, Speaker.
Thank you. The next question, once again, the Leader of the Opposition.
Thank you, Speaker. This question is again for the Premier. The government's announcement to shut down the Ontario Science Centre and lay off staff and reopen it in a new building half its size is very, very unpopular, especially for people in some of the most impacted neighbourhoods like Thorncliffe Park and Flemington Park. It's a decision that also, Speaker, doesn't make a lot of sense to most people. The official opposition NDP, we've unearthed yet another secret government document that's called Ontario Science Centre Modernization Relocation Plans. Very interesting. But what's really notable about this document is the date, August 27th, 2021. Speaker, why did the Premier keep his plans for the Science Centre a secret during the 2022 election?
Minister of Tourism, Culture and Sport.
Mr. Speaker, thank you for the Leader for the question. I got this feeling that the word tourism is a bad word. We're talking about, now hang on for a second, tourism represents almost 36 billion in economic activity. Just under 400,000 jobs, Mr. Speaker, and 82,000 business-related jobs and careers in tourism. Yet we talk about an opportunity, a destination. Tourism is about finding a place to go, drawing people in, not just people in Ontario, Mr. Speaker, but people across Canada and maybe into the United States. It's driving tourism, Mr. Speaker. A destination is important, whether it's a spa, common areas, water parks, paddling, walking and being casual in an area where you can sit and be quiet. All these great things that, you know what, tourists like, Mr. Speaker. They want to come to. They want to come here. We're making a destination a world-class destination, Mr. Speaker.
Order. The supplementary question.
Speaker. The FOI secret documents that we've unearthed clearly show that the Premier had already made a decision to move the Ontario Science Centre to Ontario Place nearly 2 years before he told the public. We also know it wasn't until later that year that the government commissioned their business case that would justify a decision the Premier had already apparently made. That business case was withheld from the public for another 8 months, despite repeated requests from opposition members to make it public. So, Speaker, to the Premier, why should the public trust a Premier who clearly believes in decision-based evidence-making instead of evidence-based decision-making?
The response, Minister of Tourism, Culture and Sport.
Yeah, thank you, Mr. Speaker. As they say, 2 cases are better than 1. 2 business cases that suggest that this is a wonderful opportunity that we'd like to think we want to explore for the people of Ontario. But more importantly, again, back to that tourism word that everyone, or not everyone, just certain people don't seem to like.
Those guys.
We talk about building up opportunity in Ontario, in jobs and careers, destinations, making an Ontario a place that people want to come to visit and stay maybe an extra day or 2 longer because the destination is so special and the opportunity is an experience that those people and their families want to experience, Mr. Speaker. That's what tourism is about. People in Ontario do a fabulous job. Those working in the industry are doing a better job because of COVID. They're smarter, they are ready, and they want people to come to Ontario, Mr. Speaker. They want them to visit. They want them to stay. We want to welcome people.
The member for Hamilton Mountain.
And we've just been listening in live there to question period today, where discussions centered around the healthcare crisis in Ontario, as well as what the NDP say are some alleged secret documents by the provincial government on the relocation of the Science Centre.